It's a complex question. Prolapse and incontinence are multifactorial overall. There are certainly multiple factors to include some things we can control and some things we cannot. People can control whether or not they smoke. That's a factor. They can control whether or not many patients can control whether or not they're overweight. That's a factor. Patients can keep their allergy symptoms under control. If they have chronic cough or chronic sneezing from other lung conditions, those can be controlled as well. There's a genetic component that cannot be controlled, and unfortunately no way to predict in those patients who's going to have that component and what's going to trigger it. Childbirth is a factor, but it's not the only factor. So a lot of women falsely believe that, well, it's vaginal delivery that results in incontinence, and that's not completely true. There are multiple factors that go into it. Usually there's not one thing that we can point to that says this is why you got this problem. But it's so common of a problem, 30% of women over the age of 30 and 50% of women over the age of 50, as far as incontinence is concerned, that by the time they have the problem, why it happened is a little bit less irrelevant than what we have to do now. Certainly, some of those other controllable factors, allergies, things like that, we want to optimize those to make sure that our other treatments end up being successful. For prolapse, kind of the same thing. All these factors kind of go into it. Prolapse and incontinence are very closely linked. Not everyone that has prolapse has incontinence. Not everybody that has incontinence has prolapse. However, we do find both in a lot of patients. And again, maintaining a normal weight, not smoking are probably the two biggest things patients can do to prevent these things. But unfortunately, some patients are just predisposed. And one myth I would like to dispel is that C-sections, prevent incontinence and prolapse, and they don't actually do that.